Hello, and welcome to our 2020 State of the Association video series. I am Leanne Stember, President and CEO of NCPDP. I know that these are unusual times for all of us, and you're viewing this currently from your home offices. I am so looking forward to getting back on stage next year at our May annual conference at the Westin Kierland Resort. In today's video, which is the second video in a series of 5, we will take a look at our strategic initiatives and the great progress that we've made over the past year. NCPDP has 4 primary strategic initiatives. Each one is focused on the patient. Each one is rooted in our standards. Together, they are powerful tools to improve transparency and interoperability, to improve clinical decision-making, and to make healthcare safer for our patients. Let's begin with the Universal Patient Identifier, which is powered by Experian Health, UIM, and the NCPDP standards. Our UPI solution has been many years in the making. We formed a strategic partnership with Experian Health several years ago to bring the industry a no-charge solution to make it easier to accurately identify patients and to improve patient safety. During the year, we focused our advocacy efforts to educate lawmakers and the industry about the UPI, its benefits to clinical decision-making, and how it improves patient safety. I participated in 2 congressional briefings on the case for patient matching. The first briefing was for members of the Senate last fall, and the House briefing was earlier this year. We also hosted a stakeholder action group to help identify the next steps for our task group. Most notably, in December, we announced a major milestone when 100% of the U.S. population had been enumerated with our UPI. This is important because it establishes a unique UPI for each and every person who has received a healthcare service from newborn babies to the elderly. So if your neighborhood hospital has taken advantage of our offering and someone named Chris Murray comes into the hospital, the physician can actually trust that the patient file they have on Chris is for the same Chris Murray that is sitting across the exam room, and not the Chris Murray who just happens to have the same name, the same birth date, and lives only a few miles in the same city. Today, our UPI Experian Health is used by public health advisors to the federal government to aid in tracking, response, and recovery efforts with the COVID-19 pandemic. We are pleased and we're honored that our joint UPI solution is showing immediate benefit at this most crucial time. Many of you are aware of our next initiative, NCPDP's RealTime Prescription Benefit Standard. This was a long time in the making. In fact, last May, CMS issued a final rule mandating that by January 1 of 2021, each Part D plan adopt real-time benefit tools capable of integrating with an e-prescribing system or an EHR. We knew that this was coming thanks to very active participation by CMS in our work groups as well as our task groups. The challenge for us was, how do we develop the standard so that it could be implemented in time? It was a test of our agility and our dedication. It also meant we needed to do something we had never done before, to step outside of our process and move forward a beta version of the standard. The vote to approve the beta of the standard passed without opposition, which showed really strong support for the standard from across the industry. Throughout the year, we actively focused our advocacy efforts on increasing awareness of the standard through articles, presentations, as well as Hill visits. The NCPDP Foundation also supported the standard by funding some research projects. Version 1 of the Real-Time Prescription Benefit Standard was balloted in March of 2020. Our specialty pharmacy initiative continues to sustain momentum. Our focus has been on supporting the work group and getting the word out to increase participation in its task groups. In addition to marketing activities, we gained visibility with 2 influential organizations in their constituencies, Asembia and the National Association of Specialty Pharmacy, known as NASP. We had 3 30-minute sessions at Asembia's 15th Annual Specialty Pharmacy Summit in May, and we participated in a panel discussion on improving data standards for specialty pharmacy at the 2019 NASP Annual Meeting and Expo. We are continuing to collaborate with NASP to increase its organization's awareness and engagement in our work groups. In 2020, 2 new task groups were created, the Patient Consent Task Group and the Facilitating Access to Specialty Products Task Group. And later this year, the work group will publish best practice guidance on determining specialty medication coverage through the pharmacy benefit or the medical benefit. I encourage you to reach out to your colleagues and contacts in specialty to get them involved in our task group calls. Our longest standing initiative is our standards-based facilitator model for PDMP, which was developed to address the opioid epidemic. We hosted a stakeholder action group last year to discuss and inform participants about the design of our model, to talk about barriers to adoption, and determine if any refinements are needed to our model prior to industry adoption. We learned that there was consensus on the need for our model to enhance current PDMPs. We also determined that the facilitator model should occur in phases. Our PDMP task group made extensive updates to NCPDP's PDMP white paper based on the recommendations from the Stakeholder Action Group, and the white paper was published in March. On a personal note, it's been 2 years since my son Daniel took the stage at our 2018 annual conference to share his experience with addiction. Last year, he joined me on stage when I was invited to speak at the Healthcare Innovation Pacific Northwest Summit. We had an unforgettable time sharing our experiences, including a very candid and interactive fireside chat. It was both eye-opening and comforting for many people to hear that they are not alone in this opioid epidemic. Our facilitator model has the potential to be used for far more than the opioid epidemic, and soon I hope to share more information with you on how it can be used to support COVID-19 efforts. In our next State of the Association video, I will provide an overview of the Board of Trustees' new 3-year strategic plan. The plan was approved this month and the inaugural meeting of the 2020-21 Board of Trustees. One important feature of the new plan focuses on our need to be creative and innovative in accelerating the time it takes to develop and enhance our standards and guidance. We are already showing our ability to do that, as you have heard today with our real-time prescription benefit standard. Most recently, our Emergency Preparedness Task Group demonstrated our collective ability to prioritize and pivot to support pharmacist-led COVID-19 testing services. We need more of that today and in the future, and you, our members, will help lead the way. Thank you for watching, and I will see you next time.